is that 20% of the population spends 80% of the healthcare dollars. So the majority of people think that the current system works because they don't have to use it, not in a meaningful way that impacts on their lives. And so that's one of the reasons why it's been so hard for people to wrap their brains around this. One of the women who spoke last night...
You're saying it's hard for them to wrap their brains around it because they themselves haven't been touched enough to be able to put themselves in the other person's shoes?
Exactly.
But at the same time, if they haven't, and I believe you, hasn't one of their family been touched enough for them to feel it? I mean,
I think that's happening more and more, so that at least people are talking about it. But it's one of the reasons why we've had such a hard time in terms of pushing it through. They say, well, I have health insurance. And and sure, you can have health insurance, but until there's something catastrophic occurs, you don't really have a sense of the limitations of whatever insurance. People say, I have a good policy. And I say, well, how good is that policy? If you separate your shoulder, do you know how many physical therapy visits that policy allows you to have before you're on your own? And, no one reads it in that detail. But these are the sort of things that people discover when they suddenly need to determine the extent of their benefits.
My friends, we have 2 minutes. I want to ask Drs. Miller and Fagan one last question here, and it's I opened the show with a reference to my father, and it seems like a good point to jump in with this because we were talking about those who are close to us who are sick and suffering, who are unutterably alone, as Rilke pointed out, and that's our parents. Dr. Fagan, say a word on elder care. We've seen so much in the correction systems where, with the decommissioning of the mental hospital system, that jails and prisons have become de facto mental institutions, and one could argue that is very much the case for nursing homes, that they have become de facto institutions, warehousing. I don't want to use the word warehousing, but
well, it does.
for elders.
One of the issues we raise is that if we had a real healthcare system that addressed the needs of patients, couldn't we find ways to provide care for those patients in the community instead of shutting them away someplace where no one has to look at them and be reminded of the problems that exist there?
Will a national health care program address elder care in that way?
We've talked about this, about not just elderly, but the disabled, who we often are too quick to shutter away in a building or out of the community, whereas it's better for them and better for the community when they're allowed to be cared for in the community. But it's because of the financial incentive for nursing homes that's what we choose to do, and actually might even be more cost effective to keep these people in the community.
Thank you. That's a good place to end on. Dr. Fagan, I want to thank you so much for joining us, particularly taking your time out this week from the convention in Denver. I hope to see you in the next administration. I hope. I'm very active in the Obama campaign here, and not that it's worth 2 cents, but I'm actually going to make a DVD of the show and then make copies of it and give it to the people that I know. I think you would be wonderful in a senior level position, Health and Human Services. So good luck to you, ma'am.
Thank you.
Dr. Miller, thank you for joining us on the show. We hope to have you again.
Thank you very much. Let me just say quickly that on Tuesday morning, this coming Tuesday at 9 o'clock on my program, Mind, Body, Health, and Politics, we will be talking about elder care. The subject
wonderful.
We just brought up with Esther Koch.
Very good. I also want to thank our staff here. I want to thank Mary Agner, who is producer show in many ways. I want to thank Caleb Clark, who's on the board, engineering board here in Ukiah. I want to thank Rich Culbertson, who is on the board in Philo. I want to thank Ryan Morris for doing some research for this program, and I especially want to welcome our new station manager, John Coate, to KZYX. Thank you for listening.
Thanks.